The oral appliances for snoring are very effective. Basically what they do is they posture the jaw forward, and it keeps the tongue from collapsing back in the back of the throat and the jaw, and minimizing that airway and stopping the airflow. And that's what makes the sound of snoring as it tries to pass through that narrow opening and things vibrate. So it's a problem for a lot of people, but the oral devices do seem to work. The compliance is better and the results are better than with, say, a CPAP. You've probably heard of one of these, a medical device called a CPAP. So for people who have tried that and it's not worked, then usually the oral appliances work.